She's still getting high temperatures and having good and bad days. So what do we know about how long a complete recovery takes? James Gill is a GP and Honorary Clinical Lecturer at Warwick Medical School.
The patients that we've got at the minute, about 85% of people are going to get mild symptoms. And realistically, that's the group that we know the least about, because we're being exceptionally cautious in the community at the moment. And if you've got a temperature, if you've got the cough, we're making assumptions that this is coronavirus. So in terms of the mild patients, we might not have such a good handle on the recovery.
For the people who've had a milder illness where they've stayed at home, in terms of the fatigue, what would you advise people do? Should they take it easier than they think in case that fatigue is going to come? Do people need to rest for longer, basically?
Absolutely, without a shadow of a doubt. I personally, when I worked in ITU, I got Epstein-Barr virus, so I had glandular fever. And I was completely knocked back with that. And even when I went back to work, I would find that by 1 o'clock in the afternoon, I was dead on my feet. But if people have coronavirus and they're getting this tiredness afterwards and they try and push themselves too hard, that will not only be more difficult for them to feel well, but it may even put their recovery back.
And would you expect that to be a lot worse in those who were admitted to hospital and who were so much iller, particularly if people have been in intensive care? I imagine the road to recovery is pretty long.
In terms of those moderate and severe patients, we can extrapolate, what's going to happen with them potentially. And we need to understand, if you're one of those 5% of people who are really unlucky and end up in the ITU department, you are literally fighting every day that you're in there. To put it in perspective, most people, if they tried, could manage to, walk or run, a 5K. Now, if you're a bit fitter, you can perhaps run a 10K, and you're going to be tired afterwards. You're going to be a bit strained. If you're running a 10K every day, at the end of a 5-10 day period, you're going to be wrecked. And that's what we're seeing with the patients in ITU. They are fighting. It's a hugely intense physical battle that these patients are going through. And when they are discharged, hopefully down to step-down care, we then have to work really hard with physiotherapists, with nutritionists, with psychologists, helping them get back to their health. And that could take 6 months to a year for some patients. Again, this is so early in our broad knowledge of the disease. We're still finding out things on a daily basis.
James Gill. And